One of the things that I've been reflecting on just recently is how far we have come in the 4 years that we've been in operation, and how much that from that we're moving into a phase that is really starting to influence the system, and also to input ideas and very practical solutions to problems that the system, the healthcare system, is experiencing. Some of which I want to outline to you shortly. So we're moving through a cycle actually being operational, I guess, in kind of NHS, kind of HEE kind of language. We are actually starting to perform with outputs. But equally, I suppose that we're a dynamic workforce, and as a network we're growing. So I think it's really important that we don't forget that we are bringing new people into the network, and part of the measure of our success is how much we bring new people into the network, thinking about psychological approaches and joining us. So hence, I just wanted to revisit what our kind of core principles were, because I think when you get kind of involved in the day-to-day nitty-gritty of a very, very busy, rapidly moving environment, it's very easy to forget the core principles. So I want this really to be a check of, are we still on track? Are we still operating under the principles that we set out? So our kind of vision is underpinned by 3 key principles, and every time that we do something or an idea comes to us, I guess that what I ask of it are 3 things. One is, how is it informing the workforce? How can the network use this to inform you? Are we actually performing that function? Is what we're doing enabling you to be able to do your job in a more effective way? In a way with more satisfaction and kind of well-being, as we've talked quite a lot about today. Kind of how do we make sure that that we are actually having a feedback loop into the workforce that's creating a healthy and skilled workforce? And then thirdly, are we able to influence across the system things that are happening? So as well as looking inwardly into the workforce, how do we look outwardly, and how do we start to bring the expertise, an example of which we've heard this morning, the richness of expertise that's been involved in the trauma work this morning is a real example of how actually it's the psychological professions that took the trauma offer out to Greater Manchester and led the way in leading the thinking on it, helping make it work. And that's the kind of environment that we want to build, this kind of community of practice, where we're seen as a place to come for ideas and evidence around solving problems that aren't just within our own sphere of everyday work, but actually across the health and care system. So a good reminder of what the network was intended to do. And I think that as we look at what we have been doing, I think that is clearly what we're starting to do. So I only have a few minutes to summarise how we're looking at our work, but I guess that we've got 4 elements of work that we are involved in. So the network has its day-to-day core business. And that is largely around the website and dissemination of information and updates, sharing of information from across yourselves through the website, but particularly the e-bulletin. And I think that the feedback that we get is that the e-bulletin is really, really a useful source of information and sharing of things that people wouldn't normally get drop in their inbox. So how we can build on that, I think, in this coming year is something that we want to take forward, and particularly thinking about how we use social media more. So as Geeta explained, we did a clinical psychology consultation event and we live streamed it. So whilst we had 40 clinical psychologists in the room, but I think we had an audience ultimately of over 1,000, some of which were watching live, some of which viewed it afterwards. So I think we need to be thinking about how we engage with that kind of way of communicating with people in busy lives. The second part, and this is a particularly, I guess, an area of growth, is around working with Health Education England on workforce and education transformation projects. We've got some examples of ones that we very successfully managed to get funded by HEE last year. And the thing about that is that the ideas for these workforce transformation projects have come from yourselves. They've come out of a special interest group, they've come out of a problem that has been posed, and then people have come together and said, you know, could we do something about this? So we really have demonstrated that community of practice approach. Workforce planning is the other area that we are heavily involved in, and in my role at the moment as the Interim North of England Mental Health Lead for Health Education England, I'm working with Derek Marshall, who you'll hear from in a little while, and we're charged with pulling together a workforce plan that is in response to the HEE Stepping Forward document that you'll hear more about from Neil. But at the moment, there is a big piece of work that's going on through the STPs in NHS England to try to understand what's the workforce that we've got at the moment, how does that look, does that fit with what you need, and we'll be taking that to the next step locally of thinking, well, what do we need to do to actually make it more relevant, locally relevant, all in the context of this government agenda around expanding the mental health workforce by 2021. So this afternoon you'll hear more about that, but that's certainly, I think you've probably, over the years, you've heard me talk more about workforce planning, and a number of you will have heard from Mike Farrer, who has talked to us about workforce planning in various degrees. Mike Burgess. I'm getting my mics mixed up. So Mike has been, particularly around IAPT, and whilst as a clinician, you know, day to day, you might think, what has workforce planning got to do with me? Sounds really boring. Well, it has a lot to do with the shape and the progress of the workforce. And one of the things that I've learnt is that the voice of the workforce is very underrepresented in those discussions and that planning. But you are the people that often have solutions and very good ideas and can spot the problems. So we want to try to harness those to get those back into the system, which is where the roundtable discussion is going to lead this afternoon. So the fourth part of our work is around kind of northern and national and northern collaboration. So already we've reached across the north. So what was a northwest initiative has now become a collaboration where we have links into the northeast with their equivalent of our workforce board. And in Yorks and Humber, there's interest about how the network can help support the work that they're doing. And certainly across the psychological wellbeing practitioners workforce, we've really shown how you can bring together a workforce across the north. And we really are leading the way nationally in bringing together the professional voice for PWPs together. And they are becoming very active in contributing to innovation, transformation ideas that are feeding into Health Education England planning. So that's a very good example of northern collaboration. In terms of our national work, well, increasingly as the network gets publicity and gets recognised for the expertise that it holds, we're being asked to be to sit on national bodies, to consult into expert reference groups, and members of the network are becoming involved in that work through that approach to the network. And as Geeta also mentioned earlier, we're really pleased that we've now got a PPN that is in the process of being set up in Kent, Surrey and Sussex, HEE. And we're working really closely with Alice. Are you around, Alice? All right, so there's Alice over there. Hi, Alice. So we're kind of thinking about how the KSS can build on what we've done and kind of learn from our mistakes and be out the starting blocks earlier. But we're really keen to start thinking about how we might start reaching across down to the south. We've kind of really got down to the East Coast. So over the coming year, that's going to be one of the things that we're going to be start looking at. How do we collaborate to, again, building that voice for the psychological professions? as examples that this work does turn into concrete offers and concrete work, I just wanted to flag up 3 really important projects that have been funded by HEE, that the PPN are managing and have commissioned and are included in delivery. You'll get the slides, so if you want to know more about them, you can contact the project leads. But I think this is a really good example of how we can innovate and think outside the box when we're working multi-professionally. So the first workforce transformation project that we had funded by HEE is to roll out Connect 5, which is a multi-professional core skills in mental health training programme. And we are offering that out to primary and community care settings. Elizabeth Williams, who is our public mental health workforce board representative and also public mental health lead with Stockport Council, is the person that has been seconded to the Royal Society of Public Health to deliver this. Elizabeth's details are there. If you want to know more about it, please contact her, because we're looking for sites to engage in training up trainers. But a very exciting development, because already nationally people are saying, we want some of that. And what we're thinking about in the Northwest is how we can develop a training hub. So thinking about not just doing training, but how do we train up for sustainability? So one of the things that we're interested in is, are there psychological professionals working in primary and community care that might want to train up as Connect 5 trainers? I can see PWPs potentially being in a role to do that. There might be other professionals working in the Northwest. So do contact Elizabeth if you want to know more, and we've got an engagement programme around that. We have commissioned the development and delivery of a training programme for teams that are developing as Core 24 mental health liaison teams. That's very much in response to the 5-year forward view. That's being jointly delivered by, is it Northwest Boroughs? Is it Northwest Boroughs? That's a new title for Northwest Boroughs, yeah. Northwest Boroughs and University of Salford. Clare Bullen Foster is the clinical lead for that project, and Clare's details are on there too. But there will be some information that's coming out to invite people to engagement listening events, because part of the commissioning of the training is to actually get them to develop the programme. So we're very interested to hear from anybody that's interested in mental health liaison work, because we want to use our expertise to inform the development of the curriculum. So look out for that. We'll be sending that out through the network. And then finally, we last year were able to secure some funding to evaluate a small pilot of assistant practitioners working in IAP services. And I'll name and shame, I think, Claire Maguire here, as being the person that raised many years ago in an IAP collaborative. Is there something that we're missing? Are we missing a trick with assistant practitioners? You know, that kind of, so it's kind of band 3, band 2, band 3, band 4 roles. It's a good example of how long it takes for an idea to turn into practice, because I think 3 years on, we got the pilot and we got the evaluation. It's looking very, very promising. Very promising. Lots of really good positive information back from services. So we're looking at next year, thinking about how might we scale that up, and already we're seeing that kind of stepwise progression. So again, if you want to know more about that, Paul Barber is the contact for the project, and his details are there. So you can see that we've got those 3 projects that have been underpinned by money and expansion that has allowed us through the network to be able to do something that's different. And the key thing for us is that we are transforming services, you know, adding to what's happening. There are a couple of other collaborations in there that are around suicide prevention and online learning that we're doing with public health, and diagnostics for mental health, improving detection of physical health conditions within mental health settings, particularly for people with serious and enduring mental illness. That's a project that's just in its early infancy, but really, really interesting work with the healthcare scientists. So watch this space on that. But we've been working with Paul French and others on how we might trial that in Greater Manchester. So very definite, not just wise, nice words, real outcomes. We've got testimony here. I'm shamelessly put a testimony from Neil McLaughlin, because I think it's always kind of nice. And Neil is the person that continues to fund and support the network. I say Neil funds, but you kind of make the case, don't you? And you've been very, very pro this community of practice approach. And I couldn't find a better way of summing up what the offer of the networks is really into the system. So I think that what we have there is a real kind of example of how we are using the psychological professions' workforce expertise to actually move just beyond the day-to-day grind and effort that's involved with doing what you do so well, but actually being able to be creative and influence things. So finally, for the future, and I think that this is what this afternoon's about, sort of helping you think in that inform and enable way. I want you to be informed about the workforce planning work that's going on, and also give you an opportunity to influence it. So that's really what the core business for me at the moment is about, trying to make sure that the psychological professions are on that workforce planning map. We are big in our own minds, we're important in our own minds, but you go out into the wide world, and mental health and psychological professions within that are still, they're still quite a small voice. So we can't be complacent. We have to keep reminding people. We're going to be building on our northern and our national reach, and we're going to be particularly thinking about how we link in with the sustainability and transformation partnerships, that's the word, yeah. I've got a brain block on that one. Over the coming years. So you might see us emerging in different forums.